there are a lot of countries that have invested in HIV response. HIV is still a significant burden in many countries, in low and middle income countries, right? So countries, let's assume a country has invested, hypothetically, let's assume $10 million on their AIDS response. Now, if a country has invested $10 million in the AIDS response, it's really important to understand how are these $10 million invested in? Who is receiving those services? Which kind of services are being implemented in the country? How different, what is the equity in the distribution of these resources across the country? And if it costs to do this kind of an assessment for less than 0.5% of their total funding in the country, that is what NASA aims to do that. And that is why it is important to really understand how is the allocation, is there room for optimization? In addition, if a country has done a NASA, country is able to report to the global monitoring frameworks at a global level, which I'll come now. There is a mandate because of the political declaration to end AIDS that countries are obligated to respond on the monitoring targets which are set by the political declaration to end AIDS. And there are financial indicators. And if a country has done a NASA, they can accurately report on the financial indicators on the global AIDS monitoring.
I think it matters because it complements the programmatic data. If we really want to understand the response, it's not only about how many people have we reached or which key populations are limited in access and so on. It's about the money that's been targeted to them. So you really see priorities when you look at money, and it's the guys with the money, I've always said, who actually control the response at the end of the day. So if you can talk to them with financial information, with evidence that you can say clearly there's a shortage of spending in this area, we need to redirect, we need to mobilize, then I found it a very powerful tool to help program managers improve their programs.